Hi everyone, your teacher Mrs. Albert reached out and asked if we would mind sharing our profession with you. My name is Mary Beth and I am a flight nurse with NorthSTAR Medevac. What is a medevac? It's a helicopter with medical equipment to provide immediate transport and treatment for patients who suffer from a life-threatening illness or injury. This is the interior of our helicopter, and as you can see, we have all kinds of medical equipment. We have ventilators and heart monitors. Basically, we can provide the same care that an emergency room would provide in the first 10 or 15 minutes of treatment. To obtain a nursing license, you either need to complete a 2-year associate's degree or a 4-year bachelor's degree program and then pass the state licensure exam. To be hired as a flight nurse, in addition to your nursing license, they require that you have 3 to 5 years of clinical experience in an emergency room or in a critical care area such as an intensive care unit. They also look for nurses that have pre-hospital experience, and you have to have a valid driver's license. To obtain a paramedic certification, you can go to one of the local colleges here in New Jersey and do either an 18-month program that gives you certification, or you can do a 2-year program which gives you an associate's degree, and colleges outside of New Jersey also provide certification through a bachelor's degree program. To be hired as a flight paramedic, they look for 3 to 5 years of experience in a very busy EMS system. They also look for experience in critical care transport, and again, you have to have a valid driver's license.
16-year-old female involved in a motor vehicle accident, head-on. Really all you complain is can't feel her extremities, her lower extremities. Pressure is 90/60, heart rate 120. With 18 gauge started, normal state.
As a flight nurse or a flight paramedic, we interact with a lot of different agencies like first aid squads and paramedic units, fire departments, police departments, also different hospitals and different departments within the hospital. In addition to having to interact with a lot of people, our job is also very physically demanding. There's a lot of lifting and carrying and climbing in and out of things, as you can see from the video. At NorthSTAR, we have 2 pilots, both of which are New Jersey State Troopers. To become a pilot, they have to be a trooper for a minimum of 5 years. They have to have their private pilot's license in either an airplane or a helicopter and a valid driver's license. This is the cockpit of the aircraft. And we have room for 2 pilots. We always fly 2 pilots with this program. Being a medevac pilot is very different than being a commercial airline pilot, where you would take off at one airport and land at another. Medevacs tend to land in unsecured landing zones like baseball fields or on a roadway. And then we also land at hospitals which have elevated pads. So the pilots have to be very comfortable landing and taking off in different environments. Because our pilots are state troopers, we can be requested to assist with police-type missions. These include searching for people that are lost or searching for someone who is suspected of committing a crime. We can even be requested to help with a search and rescue that requires someone being hoisted from a position where we wouldn't be able to land. I hope everyone enjoyed learning a little bit about what a medevac is and all the different careers on it, and that you guys have a good rest of your school year.